Hello, my name is Jeremy with Faith and Guardian Training Center. Today we're going to be talking about diabetes, which is part of the endocrine system. Today we're going to be specifically talking about type 1 versus type 2 diabetes and the best ways that you can really kind of differentiate between the two. So diabetes is a disorder of the endocrine system, and it is an issue with the body's ability to uptake or use insulin, which is how your body controls your blood sugar levels that allows your blood sugar to actually enter the cells to get used, goes through the Krebs cycle, and that's how energy is created. So type 1 diabetes is typically diagnosed during childhood or puberty. And so what happens is the body fails to produce any insulin, which means that your cells cannot uptake the glucose that you intake when you eat. So these are typically going to be your insulin dependent patients who may be wearing insulin pumps all the time, and they're typically not going to be overweight. Is not commonly seen in those types of patients. The exact cause of type 1 diabetes is unknown, but there could be a viral or environmental factor that kind of goes in with them. Type 2 diabetes is typically diagnosed later in life, about 35 years and older, but that's not always the case. Type 2 diabetics is not necessarily that they're not producing insulin, it's that their body isn't producing the right type of insulin that their body is getting, that their body has been using. So what that means is that insulin is a key, so to speak. So you have glucose that needs to enter the cell for it to be able to be used to create energy. Glucose can only enter the cell through insulin. So you can think of insulin as a key and the cell wall as a door. So what happens is in type 2 diabetes, your patient may have the same keys, the same type of insulin, but the cell doors are changing. So it's essentially like you came home one night and all of a sudden all the door locks were changed. That lets you know that there's an issue, and so you're just stuck floating around outside, not being able to do anything. And those type 1 diabetics, the keys, they just stop getting produced altogether, and the key being the insulin. Type 2 diabetics, they're typically going to be able to, they're going to have insulin as well, but they can typically start off by taking it with a tablet. It doesn't always have to lead up to injections or anything like that. And sometimes type 2 diabetics can come off of their diabetic medication through diet and exercise. Type 1 diabetics, once diagnosed, they're not going to be able to come off their insulin. And those are, again, your insulin dependent diabetics. Most diabetics, whether it be type 1, type 2, their issue, the way that they get diagnosed is going to typically be due to a hyperglycemic episode where your blood sugar raises above 300, for example. And so what this does, whenever your blood sugar gets high like that, you have something called the 3 Ps. You have polydipsia, polyuria, and polyphagia. So polydipsia is going to be excessive thirst. So because your body is just excessively thirsty due to the associated dehydration with hyperglycemia. You're going to have polyuria, which is frequent urination or excessive urination. And that's going to be due to that increased thirst that you have, and your body is attempting to regulate its all of its levels and everything by excreting things through the urine. And then you're also going to have polyphagia, which is your body's attempt to bring in more nutrients, because again, with a hyperglycemic episode, whenever the insulin isn't working, it's not that the cells don't have the energy circulating through the bloodstream to get to it, because the glucose gets broken down, absorbed into the bloodstream, and starts circulating through that. It's that the cells cannot get that glucose that's circulating. So you try to eat more because your body recognizes that it needs energy. And those, again, are the 3 Ps: polydipsia, polyphagia, and polyuria.